Hi everyone, welcome to my channel. In this video, I will be talking about the exam NCLEX RN. In order to pass the NCLEX or any exam, the first step is to know exactly what the exam needs from you or what are the components of the exam. So today I will be discussing with you all the well-researched elements of the exam. So first of all, NCLEX is a compatibility exam. It means you have to pass the exam in order to hold the RN license. It means that you will be able to work as a registered nurse on the floor if you are able to successfully clear the NCLEX exam. So the NCLEX exam is a CAT exam, that is Computer Adaptive Test. It means that the computer gives you questions and depending upon the response that you give to the computer, the next question will be decided at that moment. It's not a set pattern of exam, it's not a set number of questions like one after second, but it will depend upon how you answer to the computer. So the minimum number of questions that you get in an NCLEX is 75 and the maximum are 145. In this, the computer will determine whether you are capable of working as a licensed nurse on the floor in the hospital. So there are different scenarios for passing your NCLEX. I will just go through them briefly. The main thing that you need to know is 75% confident rule. This means that if the computer is 75% confident, in other words, we can say, take this graph. This is the minimum level that is set by NCSBN. So what is NCSBN? NCSBN is the body that makes the NCLEX exam, that give the questions for the NCLEX exam. So this blue line, this is the minimum level for a nurse. Like this is the level at which they should be able to answer correctly. So when you're given a question, suppose that is below, that is easier than the minimum level. A correct question will take the graph in the upward directions and a wrong response will take the graph in the downward directions. So according to the 75% confident interval rule, if you stay above this line, above the minimum level that is set by the NCSBN for 95% of the length of your exam, you are able to pass the exam. The second phenomenon when the exam stops is maximum length of the exam, that is 145 questions. If you have done all the 145 questions, and the computer will stop at that time. And the third scenario is, this is the scenario that's important to know if you are having lack of time. So you don't need to worry, like this is run out of time rule. In this rule, there are two things. If you have done the minimum number of questions, that is 75, at that time, the computer will determine from those minimum questions that how capable you are. But if you have not done the 75 number of questions, then you are marked as a fail in the exam. So this is the main thing out of the different scenarios that you need to know. And so these are the questions that come in the NCLEX exam. But as you all know, the exam is going to change from 1st of April. There will be slight variations in these questions. You don't have to worry about, because the exam is not going to change in an instant. It's going to take slow progress towards changing till 2026. So it's not going to abruptly change on April 1st. So the most common type of questions that we get in the exam are the MCQs, the SATAs, that is select all that apply, ordered responses, and then the ones that we get for lesser are filling the blanks, figurative questions, chart, exhibits, graph, and audio questions. And as they can be known from the titles of these questions, what type of questions we get. And we will be discussing about the next generation NCLEX in detail in the next video. So stay tuned, and you can comment down below if you have any queries that you want me to clear regarding the NCLEX exam. Thank you.